estradiol. Unfortunately, women ages 20 to 40 lose half of their testosterone starting in their 20s. Us men will lose 1 to 3 to maybe even 5% per year beginning in our 20s. Cumulatively, damage begins occurring, and I'll show you what that looks like. Some of the men might come in saying, Doc, I need some of those blue pills because things aren't working as well as they used to. When I see that, I think, that's the tip of the iceberg. What's below the surface? 8/9 of the iceberg is below the surface. So they battle problems with blood pressure and cholesterol and clogging of the arteries and diabetes and all kinds of oxidative stress and other things that are really starting to damage their body. So us men, when we get low T, we have what's called andropause. At least here, the dog is getting some exercise, but sometimes we just don't feel like going to the gym. Facts about andropause, also known as menopause. 20% of the males below age 50 have it. It's directly connected to diabetes, blood pressure, cholesterol, sleep apnea, chronic illnesses, oftentimes goes underdiagnosed. And so we need to improve that. So here is probably one of the most important charts you'll see tonight. You're welcome to take a picture of it. We'll show you how this directly impacts. But this is a picture of serum testosterone levels in young men. Imagine the young men down here in their perhaps 20s, and their numbers belong right up here, 900 to 1,000. Okay? Well, again, we lose 2 to 3% or more per year cumulatively beginning in our 20s. As it drops below 900, we lose the protection testosterone offers against Alzheimer's disease. Below here in the 700s, we start getting metabolic. In the 400s and 300s, we're getting fatigue, libido loss, our cholesterol's getting up. Down here, we suffer from things like depression, anxiety, might even become perhaps a little bit suicidal. PTSD symptoms really manifest themselves here. And then down here, the plumbing just doesn't work well. So us men, we not only like, but we need our testosterone. And so we can move that back up. And as that testosterone drops, we gain weight, our muscles get weak, we can't exercise as much. No wonder we don't feel like going to the gym. So restoring that is very, very important to help us feel better. Now, before I cover this slide here, let me just back up here. And let me ask Dr. McCormick, would you mind coming up? He contacted me a few weeks ago, said, hey, I've experienced some results since doing this, and if you ever need me to share that with anybody, I said, I sure would. So we invited him. Here he comes. So he has a practice on the east side of town. Do you mind just sharing your professional experience of what you have, and then tell people about maybe what you battled before and then what you have benefited from BioTE?
I'm Dr. Marcus McCormick. I practice functional diagnostic medicine in Augusta, Kansas. I have a medical condition that causes hypogonadism, and I have low testosterone. Even in my 20s, I had recorded serum testosterone of about 87. So I've been on hormone replacement for a little bit over 20 years, and anybody who's been on hormone replacement can identify with the term roller coaster effect. It is the worst feeling in the world. Up and down, you never know what you're going to get. A colleague of mine introduced me to BioTE and Dr. Seacrest about a year ago now. And I came in for my first visit, and about 4 weeks after my first visit, it's the best I have felt in more than 20 years, and I have not felt even anywhere near the crash that I had before I came in on BioTE. The difference between injectable testosterone and the bioidentical is amazing. It's worth every penny, and I'll be doing this continually. Yeah, I feel better. I have better appetite. My body weight stabilized, right around 270. Right where I feel good. I have energy. I can even go out and move a couple thousand pounds of firewood and just shake it off. I love it.
Great. Yeah. And I've noticed since I've seen you over the last year, you've kind of grown in size a little bit from weights. Are you spending time in the gym?
Not as much as I'd like, but like I said, my weight has stabilized. When I was on hormone replacement therapy, it fluctuated a lot. I don't go much off 270 anymore. Okay. I feel normal. That's the best way to say it.
Has anybody else noticed?
Oh yes. Definitely my patients. Which a lot of them who I refer over here. They could tell, when I'm with them, more vitality, this beautiful young lady right here can definitely tell. My kids, I'm, more attentive. I act and feel a lot more like I did when I was younger in my 20s.
Great. Thank you very much. Congratulations on your success. He brings up a key point, and that is he feels more like he felt when he was in his 20s. And that is one of the key goals of the therapy, is to help restore these levels wherever they currently are. We don't know. Perhaps a blood draw will reveal that. But restoring those levels to the levels we enjoyed when we felt our best, which were when? Our 20s and 30s. And so that's a sense of rolling back the clock. And I think that's, in a way, that's what you described to me, and that's what you're living now. Yeah. Very good. Well, thank you for sharing that. One of the biggest concerns that I think people experience, or they have a question of, especially with men, they say, hey, doc, somewhere along the line I heard that, doesn't testosterone cause prostate cancer? Has anybody ever heard that before? We actually found that kind of research that's out there. And I think this issue has been settled once and for all by a gentleman named Dr. Abraham Morgentaler. He's a key thought leader in the field of urology. He speaks at the Urologic Society meetings all over the globe. Him and his colleagues have actually produced a Mayo Clinic Proceedings published article talking about the general consensus statement of testosterone and its safety worldwide. And he basically settled the issue once and for all. He says, I have 19 studies that show there is no increased risk whatsoever with men who take testosterone therapy. In fact, the opposite is true. He says men who suffer from low T actually have a higher chance of developing prostate cancer. And then when they show up with it, it's already kind of advanced in the stage. They have what's called a higher Gleason score. Now, if you think about this, makes a lot of sense, right? If high testosterone caused prostate cancer, you would think then there's a lot of 18 and 20-year-old young men running around with a lot of prostate cancer, right? It just doesn't pass the sniff test. And he was able to prove that. In fact, he has now taken certain patients with their consent who have low-grade prostate cancers already present and diagnosed, and he is actually inserting testosterone pellets into the cancer under medical studies, and it is actually showing, in some cases, a regression of that cancer. So not only does it not cause it, it helps prevent it, and then can help in a very positive way in getting through that. So great safety data. I love that. So here's some of the effects that you heard from Dr. McCormick. Hey, increased energy and vitality and zest for life. And women, listen up, because this applies to you as well. Feeling of overall well-being, relief from anxiety and depression, relief from brain fog, improved mental clarity and focus. And then we're protecting the glands like the prostate and the breast and the heart and the bone. And we're reducing body fat and lowering cholesterol. We're even having stronger tooth and nails and enhanced libido and performance that people are noticing and remarking. In fact, this has been shown to increase a person's own growth hormone by 22%. I'm going to show you how to get free growth hormone here tonight. Optimize your testosterone, guess what? Growth hormone increases without any of the cost and those kind of issues. How about cholesterol? I love this chart because it shows that purple line is your good HDL cholesterol. That actually increases with testosterone optimization. Lower cholesterol, the bad cholesterol and all the totals all go down. There's no prescription drug available in the marketplace that I could write out that would do what this does, certainly with not to mention all the safety data, as well as helping all these other areas of the body. So your lipids will just flat out improve as a result of testosterone optimization. Now, I'm going to give you a couple peeks into my medical record here a little bit. This is a scan I had run here recently. My wife and I went and both got one. And we actually went over to Dr. McCormick's neck of the woods. We went over near Andover, and we went and got this scan. This scan cost us $50. It's called an ultra-fast CT scan, and they scan your heart really fast. The hardest part of the test is you have to hold your breath for about 5 seconds. Hope someone here can do that. And they measure the amount of plaque buildup in your heart. And so I was so thankful and pleased. It says my total calcium score is, can you read that in the top line there? If you can from the back, that's 20/20, by the way. Can you read that, Lucas?
Yeah.
What's it say?
Which one?
Total calcium score, top line.
0.
0. So what that means is my coronary age, can you read that at the bottom? less than 35. Now, I don't know whether that means 39 or 29 or 20 or whatever. I'm just kidding. But it says that I have the amount of plaque buildup as that of a less than a 35-year-old woman. So I'm thankful. Guess what? My wife has the same thing. It's probably a lot of her good cooking is really what it is. But this is a result of good testosterone optimization. How about the ladies? All right. Women. 3,500 women enter menopause daily. Symptoms may begin up to 15 years earlier. Most women are affected by it. They never get over it. They never get through it. And so it affects them in a big way from a negative health standpoint. Estrogen. Yes, it's present in both men and women. Us men need estrogen. Our body makes a little bit of it. It's what makes us nice. We need to have some of that. Okay, the ladies, however, it's controlling things like hot flashes and night sweats, and it's making the bones strong. It's the feel-good hormone. It gives their skin that pleasant appearance and gives the collagen in the skin to make us look better. So that's a very valid, extremely important hormone. So much so that potential and unnecessary side effects of oral estrogen therapy. Back in the day when we used to put ladies on birth control pills and oral estrogens, we found all this bad stuff was actually happening to them. They developed breast tenderness, and they were having increased risk of breast cancer and endometrial cancer, increased risk of heart disease and Alzheimer's. They were gaining weight, having some bleeding, headaches, nausea, vomiting, blood clots, and leg cramps. If you've heard those are completely true. And so the ladies, so this is what happened. Conventional hormone replacement therapy, all this increase in stroke and heart attack and breast cancer and blood clots and Alzheimer's disease, they found that when they studied the medicine Prempro, which is a combination of Premarin, which is pregnant mare's urine, that's why they got the name, horse estrogen, and progestins, which is alternative synthetic progesterone. And so the lady says, forget it, I ain't doing all that stuff. I'm quitting it. And so they were left with what they thought was no alternative. Well, bioidentical hormone therapy has been present for 80 years. And here that actually happened right here. And so people have that as an option now. So if you want to give me what? I don't think so. If the shoe were on the other hoof, I don't know any ladies here that have horse receptors in her, but they may or may not have, taken this kind of. Thanks for coming, Dr. McCormick. Sure appreciate it very much. So there's different availabilities of different types of hormones. So there's patches delivery systems. You can put it on your skin. The problem is the adhesive might be bothered. It may not absorb properly. So that doesn't necessarily work. You can apply creams or gels. You have to know where to put it on, how much. And unfortunately, it can transfer to other things like babies and pets. And it doesn't give you the heart and brain protection. And Dr. McCormick talked about this, ingestible testosterone. You don't get a good absorption. You get a big spike when you absorb it, and then it drops off. And so it actually increases the liver toxicity, elevates cholesterol, and people say, hey, it wears off, and I can tell when I get really cranky, and everybody around them can tell them when they get cranky, so they kind of ride that roller coaster. So some men try these patches, but it doesn't really fully optimize them. It only gets them halfway to 500. So the different methods are basically this, synthetic, and bioidentical, which has pills, patches, creams and gels, and then, of course, pellets. Pellets are the superior delivery system for these types of hormones. Here is why. It's a small little nick we place in your skin. We do it right here in the office, put some numbing medicine in. We slide these little pellets in the office, under your skin. We put a Band-Aid over it. The nick is so small, it doesn't even need a suture or a stitch. You wear the Band-Aid for a few to several days, and then capillaries begin growing around those hormones. And so what happens is you start feeling that hormones kick in. And then the more you work out, the more hormone level will increase. So it's released based on cardiac output, not just time release. The stronger you work out, the more you get released and unlocked. And so what happens is, instead of a spike followed by a valley, followed by a spike, followed by a valley, or a peak and a drop-off, the implant is steady state, but then you get releases after workouts. And it's super small. It's the size of this little penny. Even smaller than that, actually a small grain of rice. Now let me ask you here, there is, Chad, do you mind? I don't put you on the spot, but we talked a few weeks ago, and I actually have a picture of you. Do you mind coming and sharing your story and see what?
Absolutely.
I'll let you hold that up there. This is my friend Chad, and Chad's a fireman, but why don't you tell him a little bit about yourself and share your story? And
So my name's Chad. I'm a fireman, and about a year ago, well, before that, I was dealing with basically everything that we've talked about: fatigue, lack of focus. I'm 31 years old now, so at this time before BioTE, I was 29, 30 years old. And one of the major symptoms that I was dealing with was depression and anxiety. Depression got so bad that one day I had had enough. I took my truck into my garage and attempted suicide. My wife had just left to meet a friend, and her friend actually canceled on her. So she came home. Otherwise, I wouldn't be standing here. And without the BioTE, I wouldn't be standing here either. Anyway, so I started going to a gym here in town. Some of the guys were talking about this BioTE, and I had never heard of it before, so I started doing some research. Decided to go ahead and get tested. Got tested. Actually, I was doing the shots before that, and just like Dr. McCormick was saying, roller coaster, up and down, up and down. My work insurance, they switched insurances, stopped covering the injectables, so I crashed way down. I was at 71. 71. So I was way, way low. And that was during the time that I attempted suicide. Ended up in a psych hospital, got some help, but still was not feeling like I should be. So came in, got tested. That's when I found out I was at 71. Got pelleted, and without that, like I said, I wouldn't be here. Started sleeping better, dealing with depression less and less. In fact, I'm almost off my medication. They've kind of slowly been weaning me off that. Just way more energy, way more focus. I've got a little girl. I feel like I can be a better father for her and a better fireman, so I can help people better. So yeah, changed my life, and I just got my third round actually this morning, and I won't ever not do it. So
you've had some results in the gym?
Yes, yeah. So the one on the left there was probably a year. It was maybe 6 months or so before BioTE, and that picture on the right there was this morning. So yeah, awesome results. I'm getting PRs in the personal bests in the gym with my lifting. I feel like going to the gym every day. I'm excited about going to the gym and being more active in general. And it's showing. So yeah, great results.
Wow, congratulations.
Thank you.
On your success.
Thank you.
Way to go, man.
Thank you.
And thanks for serving in our public sector and helping us keep safe. You know, when I first met Chad, I got to tell you, I probably would not have wanted to have been rescued by him in a fire, but now I would any day long. I mean, we got an axe. I mean, you just. And so he was kind enough to come on our podcast that Lucas and I are doing, and so we interviewed him, and his story will be posted on Facebook, which you guys will find out about later too, and as well as somebody else here later today. So congratulations again. That is amazing. Let's go back up here and pick up where we left off real quickly, and that was right here. Okay, go back forward.
Just to give an update on, we've had several people comment that they've done some BioTE. It's been really helping them a lot. One lady just got her first this week, And she's really hoping. She said her hot flash has gone away, but she's hoping for some other. She's hoping for some more weight loss.
It's catching on. Great. Excellent. Thank you for sharing that. So people say, how long these things been around? How come my doctors never told me about this? Well, it's kind of interesting because they started using these back in 1939. It's widely been used in Europe and Asia. But the pharmaceutical companies never got the really arms around it because it couldn't be synthetic, so they couldn't patent it, so they had no financial motivation to spread the word. So these kind of made their way across the pond. These are natural, non-synthetic, plant-derived hormones, same molecular structure as human hormones. That makes them bioidentical, human identical, okay? Lasts longer than any other treatments. Ladies go 3 to 4 months, men go 4 to 5, some people get 6 months. The most widely studied form of natural hormone out there, steady stream of hormone in your blood, highly individualized dosing. Most people don't even know it's there. Helps the body return to the normal state. So studies basically show 75 years plus of experience, strong safety record, no roller coaster effect. It is the best method to build bone and strengthen bone to help deal with osteoporosis. No evidence whatsoever of any increased risk with breast cancer. In fact, it does not stimulate breast tissue. In fact, it will actually lower your risk for breast cancer. No, there's no blood clots, heart attack, or stroke problems because it's not synthetic. And it protects the breast, the brain, the bones, hearts, and relationships. 3 other hormones worth mentioning are thyroid. That's your hair, skin, and nails. That's your metabolism. We actually optimize that. Vitamin D, a very strong cancer prevention hormone. And then ladies only, progesterone, helping them relax at night. Getting the benefits of progesterone and calming them and the things they so much enjoy about that. So this has been a great answer for people who want to live a better life and focus on the true underlying cause of issues. It's evidence-based medicine that is healing, not just fixing and curing. And I'll just some quick medical studies, important because we have some medical people in the audience here tonight. Conjugated estrogens, that's the oral synthetic estrogens, increase the risk for breast cancer. When we give estradiol, natural bioidentical, with testosterone, there is no increased risk for breast cancer. There is actually a reduction in the risk for breast cancer. Archives of Internal Medicine, oral synthetic methyl testosterone increases the risk for breast cancer. Non-oral hormone prevents the stimulation of breast cancer. The bottom line is, quite frankly, is this. The treatment with testosterone and estradiol implants does not increase the risk of breast cancer, even in breast cancer survivors. The ladies notice a drop in their body fat. You'll hear about that tonight. Marked fat reduction was seen in the estrogen plus testosterone group. That's a drop from the orange to the green in the graphs. And again, building bone, nearly 3 times the rate of strengthening bone with testosterone implants than some of the other therapies that we have out there at all. And arthritis. By 2020, which is what, next year, it's expected to be the 4th leading cause of disability. And so this will actually help regrow cartilage tissue, helping people with joint pains, back pains, knee pains, all because of the benefits of the testosterone. Protection of Alzheimer's disease. Women on estrogen are 50% likely to develop Alzheimer's disease. Men with testosterone are 3 times more likely to develop Alzheimer's, if their testosterone is low, that is. So no increased risk in blood clots, no increased risk in cancer. And then what I would have people do is think about getting your blood drawn here tonight. Again, we have a phlebotomist. We can talk about that. I'll cover the cost momentarily. Here is basically the treatment comparison. Shots versus creams versus pellets, 3 to 4 times per year in pellets, twice a year for men, versus all these hundreds of other ways you would have to administer it to yourself to stay the best way. Now, people say, what do I need to know about my first insertion? Is there any chance of any side effects? The answer is yes. Just like any medical procedure, there's always that small possibility. The good news is they're oftentimes small, if they're present at all, and they're temporary. What would that mean? So testosterone makes the kidney work better. The kidney's job is to absorb sodium. Oftentimes when we absorb sodium, and it works really well, fluid may follow that. Not always, but in some cases it will. If that's the case, you have a little extra fluid retention. We give you a little low-dose diuretic, and you'll just excrete it over the next couple of weeks. That happened to me in the very first pelleting. I've had my 6th set installed, and I've not had it since. So that is something that can, but not necessarily will happen to you. Ladies that say their breasts haven't seen the hormone in a while, the estrogen, so they could get a little temporary sensitivity. That easily is treated with some evening primrose oil, and it goes away in a couple of weeks. Ladies could develop uterine spotting or bleeding. We simply mitigate that and handle that with addition of progesterone, easily taken care of. Some people may temporarily get a little mood swing as their hormones, and we reset your levels back to the levels you enjoyed when you felt your best in 20s and 30s. If that happens, it's temporary. It quickly fixes itself. If you don't honor the restriction that we place on you for a few short days after the pellet is placed, then you could extrude a pellet. It's not a painful procedure. We simply just replace it in there. That can happen. Some people can get a little bit of temporary acne, and that all disappears easily with an antibiotic. Men can experience a reduction in testicular size and in sperm count. So if you're in the child bearing years of your life, men, child fathering years of your life, we want you to know about that because we don't want this to interfere with that. And then the way we would reduce that particular side effect, if it were to happen, we just simply use a compound called DIM. And it's back out there in the jar. And you have to use it twice a day to actually lower your risk for breast cancer and increase your free testosterone, block any estrogen in the men. So with that, before we go into nutrition, let me just ask here. Let me hear from someone else here that's had a chance to use. Do you mind coming up? Yeah, sure. This is my wife, Kim. She wanted to share her story of what she noticed briefly, and then we'll have Julie come up after that.
Okay. Thank you. I'm Kim Sechrist, and I was super excited when Dr. Sechrist and Dr. Simon decided to bring BioTE to the clinic because in my late 40s, I was dealing with a lot of symptoms that Dr. Sechrist has covered tonight, and mostly sleep. I had a hard time sleeping. I wasn't getting results at the gym, and I was also not able to lose weight. So since that time, 2 and almost a half years later, excuse me, I'm sleeping through the night very well. I feel rested, no naps in the afternoon. In the gym, I'm hitting PRs, and I'm also noticing that I've gotten some lean muscle. And then weight loss has been awesome because I was losing my belly fat that I've had for several years. And my daughter threw me a pair of jeans the other day, and she said, "Mom, your jeans are too baggy. Try these on. They're mine." And they were about 2 sizes smaller than what I had on. So it was super exciting. So I just appreciate what they've done here.
So what size were you before I knew you?
When I met Neil, I was a size 10 when we got married, and that was almost 30 years ago. High school, I was a size 18, and my daughter threw me a size pair of 2 jeans yesterday.
Wow, from an 18 to a 2. Some people call her my oldest daughter, and you can see why. So, Julie, do you have a moment? Do you mind sharing? Julie's a nurse, and she was a little nervous about coming up here, but she texted me, and she goes, "Oh, I'm feeling so much better." And what's your take on all this? You're a nurse, and
my story's similar to Kim's. I was starting to not sleep through the night, and I wasn't working out well, and I was also just finding after I had turned 40 that I just wasn't able to kind of maintain where I'd been before. So I did a little bit of research. I talked to Kim at the gym. She told me about BioTE. I'm on my first run of pellets. I'm getting ready for my second. And about a week after I got them, I was also placed on a thyroid supplement. I quit taking Ambien, Benadryl, and melatonin. I was taking just a cocktail of things to help me get to sleep at night, to stay asleep. And I was just so surprised. I think that was the number one thing that I really noticed was that I quit taking all of it, just cold turkey, and I have slept great since I've had my pellets in December. So I've also noticed a little bit, I can lift a little bit heavier, and I'm noticing a little bit more lean muscle mass coming on. So I've been very pleased with it.
I hear reports that you and Kim are outperforming some of the 20-year-olds at Orange Theory. Is that true? Maybe. Uh-huh. Yeah. She's too modest to admit that, but it's totally true. I know that to be the case. So how about food? People are fed by the food industry, which pays no attention to the health, and they're treated by the health industry, which pays no attention to the food. It seems the two should be talking to each other, don't you think? It doesn't always happen to be the case. So There's ways to nutritionally improve all that, and we can talk about those. But here's the bottom line. Here's what people are saying. My energy's up. Did you hear the theme? I'm sleeping better. I feel like I'm getting relief from anxiety and depression. I feel like I can focus. My body fat's dropping. Greater capacity for getting in shape. I get texts from patients all the time letting me know how good they're doing. I love that. It's very rewarding. But probably some of the most rewarding things is just hearing from the guests like we have here tonight. So, Lucas, do you feel up to sharing your story real quick? And then we've got a real special individual to share their story as well. But this is Lucas from B98, 97.9, listen in the morning, every morning.
Thank you for that. So I got pellets done, how long ago? Over a year ago, I think. So same thing, I'm getting old. I'll be 50 in, let's see, about a month and a half I turned 50. Freaking out about that, first of all.
Right there.
Yeah, so, yeah, that was me before. So, and I play basketball. I try to eat healthy, but I go in those spurts while I eat bad, and you know, life happens and you gain weight. So I was thinking about, I heard something on the radio about testosterone. I was like, I got to find out what my testosterone is. So I came to one of these, got my testosterone checked. It was pretty good. It was like 580 or something, but optimal is like over 1,000 or whatever, and I'm competitive. My brother got his testosterone checked, and he was at 81, and he was taking shots, and it was like, you know, competitive brothers kind of thing. So I said, let me try these pellets and see what this is all about. Because usually when people, a buddy of mine told me about pellets, that's why I came here, but when you talk about pellets, I was like, I haven't even heard of pellets. I don't know what it is. So I came here and heard this. I said, well, let me just try this. So when I tried it, the first 3 weeks, I was like, oh, I don't really feel any different. I've been going to the gym. But by the fourth week hit, and that's when my body went into like Superman mode. It was crazy, and I couldn't believe what was going on at the gym because I try to go lightweight, lots of reps. I'd never try to go heavy. But the more I was working out, I was doing way more reps. So then I started adding weight, and I started doing weight that I could never do, even when I was 18 years old. So I'm not sure exactly what the pellets do. I just know that my body got cut. I did it for reasons for my own personal self. But yeah, it was pretty amazing. And I sleep better. Dr. Seacrest was talking about, I get up at 4 a.m, so I sleep in the afternoon. I take naps. So I usually never remember anything, but right after that had happened, he had said, you're going to remember some of your dreams. And I remembered 4 dreams in a 45-minute period when I took a nap. And usually I take 2 or 3 hour naps in the afternoon. This nap was like 45 minutes. I was like, I feel fantastic. So like I said, I don't know exactly what the pellets do. I just know my life has changed. I told Dr. Seacrest, I'm never going without pellets. The rest of my life, until how long I live, I'm having pellets. Matter of fact, my friend John, I met him at Planet Fitness. We were working out. I brought him here tonight because he's in his 50s, and he was like, man, you look young, and what's going on with you? And I was like, it's pellets. He goes, what's pellets? I said, come see what pellets is. So he's in the chair that I was in a year ago. So, I just want to tell people about it because it's literally, I don't know how it's changed my life. It just made me feel way better. So, yeah, what else?
You look leaner.
Yeah.
I've seen you in a few weeks. Your face looks leaner.
Yeah, I was going to say that too.
Really?
See?
Oh, good.
I'm be telling you that.
Oh, good. Well, that's what it's doing.
Yep.
Thank
Does
you.
it help blood sugars?
Oh, yeah. By the way, yeah, so I'm diabetic, and so I check my blood sugars. My AC1 went from like a 7.1 to a 5.6.
Wow.
Literally, yeah. And it has to do with changing your diet and working out and stuff, but I don't know what testosterone does or what it does, but it's everything that you said would happen has happened. So it freaks me out when somebody tells me something that actually works. Because usually people lie to you. I've been lied to a lot too. So
Wow, great. Congratulations on your success too. Wow. Well, great. Well, let's finish up here. So one size fits all approach. How do I get my life back? Okay, so I don't know. I want to hear from one of our all-stars here tonight. So I'm going to bring up somebody here that's now become a friend. And we bumped into each other in the gym. And as I began to listen to him and hear his story and some of the things that he's impacted, turned out that I didn't realize that I was standing in front of someone who's basically become a local hero. His story got out, so much so that a gentleman who's filming a documentary for 911 heroes at the Twin Towers, who's filmed documentaries, has captured their story. He made Derek's phone ring and to ask if he could come do his story. So Derek has had over 80 hours of video shot for him on a documentary that'll be released in the not all that distant future. And then they flew him out to California here. He just got back a couple weeks ago, but I get to call him my friend. Now I get to call him, go to church with him. And we even worked out together in the morning, but he's too humble of a guy to let you know all these things. So I have to tell you all this because he won't tell him that. But do you mind just coming up tonight and sharing with us, your story? If you don't mind, take as long as you want. We'd love to hear a little bit about yourself and your successes. I'm going to pin this on you.
Hey, Chad. It's an honor to talk in front of you, brother. So my name is Derek Espinoza. I'm a medically retired Wichita police officer. Sorry.
Mm-hmm, that way people
Do I need to look there? Can I look at the people?
whatever you want.
Okay. So I'm a medically retired Wichita police officer. Was injured in the line of duty back in 2003. My partner and I were dispatched to a Hispanic nightclub on the north side of Wichita. It was supposed to be just a small fight in the parking lot. What it turned out to be was a mass riot. My partner and I were put out in trouble for 17 minutes. He sustained 3 broken vertebrae in his neck. I sustained a TBI, traumatic brain injury. And then later on, I don't know why we just were taken to the hospital and then just given dilaudid, but that's what happened, and we were later released. After some observation, after that, the things that followed changed my life forever, and I didn't think I was ever going to get it back. Believe it or not, I was at 300 pounds at one time. With this traumatic brain injury, I began having seizures, 60 to 100 a day. I was basically told to stay home and not go anywhere. So I was inside my house, basically on house arrest. And I don't know, things just kept deteriorating and deteriorating, and I was on so many medications that it, whoops, I'm gonna stop standing here.
Sorry about that.
Sorry, weight problem. Sorry.
Weight problem.
But so, just to go through it all real quick, after the seizures were over, I was diagnosed with lupus, fibromyalgia. I was put on some really nasty sleep meds because, I had full-blown insomnia. I'd stay awake 48 hours at a time and not even be tired. Finally, one day, I went to the doctor and I was taken to the hospital, and all my organs were shutting down. Went into kidney failure, liver failure. I had a lung collapse. I had fluid around the heart, I think is what they called it, a heart infection. And the doctor came in and said, "Yo, do you want to live or do you want to die? Because you can either stay on these meds, but they're killing you, and you're way over medicated." So I stopped after staying in the hospital for a couple weeks. I was in ICU. Got out of the hospital, and you know what? Like I said, I was 300 pounds, man. I had to get my life back. And I didn't want to die, not young. My father died of a heart attack. He was a Wichita police officer. He was shot in the line of duty in 1992. And during a kidney transplant, as a result from his shooting, he died on the table. I didn't want to die at 55, so I wanted to live. And so I go to the doctor because I'm not feeling well. And you know what? I've left this part out for a long time, and I'm not going to leave it out anymore, Chad. I was so beaten down at what had happened, and nobody knows this, and now a lot of people are going to know it. I don't care. I was so desperate to find out what was wrong with me because I kept going to the doctor. And I kept telling the lady, I was like, you know what? I'm sick. There's something wrong with me. I have pains all over. I don't use drugs. I've never smoked weed in my life. I don't drink alcohol. I've never done any of that. I was like, can you please fix me? Well, took my blood, and as long as my A1C was okay and whatever the white blood cells and the red blood cells, no big deal, right? I said, forget this. I walked into St. Joe and I admitted myself into the psychiatric unit. That was very hard to do at the age of 40. But I knew that was the only place that they were going to run all my blood work. And within 24 hours, they came back and said, hey, you know what? you got a lot of problems that have to do with that we found in your blood. You have lupus, fibromyalgia, low testosterone. Found out I had a clotting disorder, so I was put on a blood thinner, which I don't know if any of you are aware of. The number one side effect to getting testosterone replacement therapy is blood clots. So when I got out of the hospital and I was searching around for all these people that would help me, I couldn't get testosterone. My testosterone, I think, was a 170, was the lowest. And I was walking around wondering why I was depressed. You know, why was I not feeling myself? Why was I having these seriously, watching commercials and just bawling my eyes out. It's like, what am I, a weak man or something? So, the first thing I did was I looked for a doctor. I finally found one. And this is what I want to caution against, and this is what I want to say about BioTE and why it's so good, is because you can find a lot of doctors out there, that are going to give you needles and say, hey, shoot this once a week, and you're going to feel amazing. And you know what? For me, I did feel better than what I was. But the fact remained, I'd been in a weight room almost all my life. And I had talked and I'd done research with a lot of weightlifters that were into illegal steroids as well as testosterone. And I knew that you needed an estrogen blocker. If you're going to start taking testosterone, it's going to increase your estrogen, correct? At least a little bit in everybody. So I'm telling this doctor who finally agreed to give me testosterone, I'm like, hey man, I need an estrogen block. Nope, you're all right. Just keep shooting. Well, again, I'm bawling at it's dangerous, because not only do you go like this, like you were talking about, and the injections, and I even tried, they said, well, try to inject twice a week, once on Monday, once on Thursday. That'll keep you from the peaks and valleys. No, it won't. And then it's even more dangerous, because when you're going into those valleys, you get irritable. And then maybe a day or two after the injection, when your testosterone spikes, I don't know, because I wasn't on an estrogen blocker, I was having roid rages. I mean, that's a very dangerous thing, especially if you're somebody I don't want to sound like I'm bragging, but like you could hurt somebody. It's a dangerous thing. So this is something that's very serious. Got to Dr. Seacrest. I did one more injection before I got here. That way I wouldn't hit all the way rock bottom. And the only way that I can explain it is it's like being in a car and you're driving down the road, and once the BioTE kicks in, it's like you just flip the nitrous. That's what it's like. Because I felt great. But I had some other issues I produced a lot more estrogen. I needed to be on the thyroid. And there was one other thing. Vitamin D. And so, but all I was getting was test, and then I got all this. And I'm not kidding, man. It was like somebody hit the accelerator. This is something that has absolutely changed my life. And to let you all know how much it's changed my life, just real quick, I got to share this with them. If you get on this, I highly, highly encourage you, don't look at a scale, okay? Go by the way your clothes fit. For crying out loud, stop worrying about the numbers, okay? Because I'm going to tell you, I've put on 10 pounds since I've got on the BioTE. But I also went down 2 sizes in pants. So, and I've had some other things, but we'll talk about that. But it felt good to lift heavy with these guys this morning. But the other thing that I want to say is just, it's going to change your life. I'm dead serious. And you know what? Just to tell you how much, I'm currently lifting weights, and we lifted pretty heavy this morning. And the energy that I had before this, I wouldn't be going to the gym right now, but I'm currently lifting with 3 herniated discs in my back. I see a surgeon in 2 weeks. So I have the energy up here mentally. And one more thing, I'm sorry. I know I'm taking a lot of people's time. Being in serving in the 21st and Grove area of Wichita, I got to see a lot of kids hurt. I got to see a lot of things that I didn't really ever want to see, okay? But I love serving my community. I love Wichita, you know? And where I'm at today, I wouldn't change it for a world because I love serving my community. But the thing is, the thing is, when I left that job, I knew that I had to get some things out of my head. And I was diagnosed with PTSD, as Doc said. And since being on the BioTE, I've actually made like leaps and bounds, gains, man. Because with the hormones, it's actually allowed me to think more clear. And so it's like getting 150% out of your PTSD therapy time as opposed to 60%, 70. You know what I mean? It just helps you think better. So, brother, I love you, and I thank you so much. Chad, you were an inspiration. When we sat down on the bench and talked that day in the gym, he showed me your stuff. So thank you so much. And I appreciate all y'all listening to my story, okay? Thank you.
Awesome.
God bless
Thank
you.
Thanks for sharing from the heart. Thanks for sharing, keeping our community safe and the inspiration you are. I tell you what, he hasn't given up. This guy has got an inner flame that will inspire anyone. And he still, to this day, serves unselfishly in a pinch. I mean, accidents, witnessing kidnappings and things like that. And so we're blessed to know you. We're blessed to have you here. And thanks for allowing us to be a small part of your life and the success you're having, because we got a lot of them ahead of us. Let me give you some final comments here real quickly.
Neil, real quick, somebody asked if you could tell them what BioTE is made of. Are we going to cover that?
Yes, and so basically it's a plant-derived hormone. We did mention that earlier in the presentation. And so, and there's more data on the website. Let me just finish this up real quickly. But basically, if a person wants to get done, let me cover the cost real quickly. So your blood draw is an important thing. We need your hormones to know exactly what we're doing. We program them to our website, which has over 4,000 permutations in it. Sorry, that's 4 million permutations. And so it's very highly customized to the person's frame. Those blood panels, when we were billing insurance, were coming in around $1,500. So we were to deal with the lab directly. Now you get the entire blood panel, not just one panel, but two, because we use a before panel and an after panel. The entire cost for that blood panel is $200. That is a before and after bundled. So it is remarkable how affordable that is. Then, based on those results, we put the pellets in you if that's what you want to do. We recheck your blood panel in 4 weeks, along with another symptom checklist. Here's the cost for the pellets. It nets out to about, okay, so for females it's $350 and it lasts 3 to 4 months. For males it's $695, about double that, but it lasts 5 to 6 months, okay? Now, if you divide that out per day, it comes out to about $3 a day. And what do we all say that those energy drinks tend to run about? $3 to $4 per day. Right, so what a lot of people realize is that they're already end up really spending the money. It's just going in a different direction. They hadn't accounted for that because now they have the energy, so they don't need the energy drink. They don't need to swing through the drive-thru or go to Starbucks. Now and they're restoring their health. So that's very important to know. The other question I get is, hey, will my insurance cover this? Unfortunately, insurances have stopped covering a lot of things in people's lives and have done so for the last 10 years. Hormones are no different than that. But you can use things like FlexSpend and HSA and MSA funds. And so if you have those access to those funds, you can use all of those things here for both your blood work and your testing, as well as some of the nutraceuticals that we'll put you on. And we also offer discounts to people who served our community, such as Derek, such as the military. So veterans, active duty, police, fire, first responders, paramedics. Males get $100 off, females get $50 off, because that's our way of giving back and thanking them for their being in way of harm, and we really appreciate that, and that's our way to return that to them. So with that, if you're on Facebook tonight, if you like what you've seen, share that with other people. Like us, we send out messages. We're going to have one more seminar. We're going to have a seminar about once a month moving forward, so the next one will be in March, so stay tuned when that will be. I think at this point, I'm going to end us out. If we have any final couple of questions from somebody in the audience, now's a good time to answer them. If not, we're going to sign off here. I'll be around. I'll hang around. You can get your blood drawn tonight if you like. And if you want to talk to any of the guests that come and share their story, I'm sure they would be blessed by that and happy to answer their questions. So a quick round, if anybody has any questions they want to ask. Anything online, we good?
Nothing yet.
Okay. Thanks again for coming tonight. Appreciate very much all our special guests, Derek, Chad, Dr. McCormick, Julie, Kim, and I hope I didn't leave anybody out. Okay. Thanks again, and have a great night. See you soon.